Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Good afternoon. I have a child with autism that is nonverbal. What are the odds of him not improving if he only attends 6 hours of ABA therapy and sometimes 4? He is an 11-year-old.
I mean, it's just not enough to show a difference. Like, that's, I think, the main thing I want to tell you. I think every parent should be aware that the early studies on ABA showed that there's a big difference between doing something like 10 hours a week and doing 40 hours a week. Huge difference. In fact, the kids that did intensive therapy, which was about 40 hours a week, half of them actually lost all their symptoms and recovered. The kids who were doing 10 hours a week, only 1 out of 10, so 2% actually lost their symptoms. So the likelihood of making enough progress when you're doing 4 to 6 hours a week is low. You'll make some progress, but the issue is that time is going by faster than the progress you're making. So let me try to explain that. As we age, so every given year of life, we become 1 year older, and our mental age, the things we learn, also becomes 1 year older. So any one of us, a typically developing person, would have a mental age and a chronological age that are the same. Okay, and that's how we are, and that's how our IQ becomes 100, because it's 1 over 1 times 100. Now, when you look at someone who has any kind of disability, like a learning disability or autism or ADHD or anything like that, it's harder for them to learn things for one reason or another, but they're still aging at the same time. So their chronological age is still moving forward, but their mental age isn't moving forward as fast. Yeah. And so what happens is that they, over time, fall behind their chronological age. And what we try to do with the ABA and with speech and OT and all these other types of interventions is we're trying to catch the individual up with the things that they didn't learn, so that their mental age catches up to their chronological age. So what that means is, typically with a child who's in therapy, they should be learning faster than peers, and they should be learning twice as much because they're trying to catch up. If you're doing 4 hours or 6 hours, they're definitely not learning faster than aging. So you might be able to accomplish some very kind of smaller skills. Like, for instance, the child might learn, instead of hitting, I can point to an icon, for instance. And that in itself is very meaningful, because you're reducing challenging behavior, but you're not giving your child the opportunity to learn as much as they can. So really, that is why we insist on intensive therapies. It's not because it's a financial thing for the provider. That doesn't matter. There's thousands of kids who are getting therapy. But it's because you lose, as your child gets older and older, I mean, just like us, you lose that brain plasticity, their ability to learn faster. I mean, look at, like, me at my age, I can't memorize another number. Like, forget it. There is just I tell my kids, I'm like, my hard drive is full. Like, do not give me new information. But, when you're a child, and especially before the age of 7, you learn a lot, right? You just learn. You're exposed to a new language, you learn. You're exposed to 3 new languages, you learn. So the younger you are, the more plasticity your brain has, and the easier it is to learn. That's why, like, your child's 11 right now, nonverbal, I would really be doing, and then that's the other issue. The older the child gets, the more, I guess, responsibilities come into their life. So for instance,
competing
school.
Things.
Yeah, so now you are obligated to also take your child to school. And so that reduces the number of hours of availability to do ABA. So really, it just, do as much as you possibly can, because the more you do, the more your child is going to learn, and that's the truth.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.